Hi, I'm Dr. Rajan Sagar from the University of California, Los Angeles. The question in front of us today is, when connective tissue disease pulmonary arterial hypertension patients continue to worsen and transplantation is warranted, what are the survival data and statistics in this setting? So there have been several publications, two of which I'll highlight right now, looking at lung transplantation in systemic sclerosis patients. The Achilles heel of this population has been the gastrointestinal issues and the systemic nature of the autoimmune disease, and whether that may impact how these patients do during and after lung transplantation. In this first evaluation in arthritis and rheumatism in 2006, the two-center experience, spanning approximately 15 years, looked at scleroderma patients compared to idiopathic pulmonary fibrosis and idiopathic pulmonary arterial hypertension patients as controls, and found that in this population there was actually favorable or at least similar survival and outcomes compared to these two control populations. This was also reviewed by Crespo and colleagues in terms of reviewing systemic sclerosis patients and comparing them to pulmonary fibrosis patients after lung transplantation. And what they found, as you can see in this Kaplan-Meier curve, was very similar and statistically not significant differences between patients who had systemic sclerosis versus pulmonary fibrosis, again suggesting that survivals were no different in systemic sclerosis-related pulmonary arterial hypertension compared to pulmonary fibrosis, both at 1 and 5 years after lung transplantation. In summary, after several years of research, it's very clear from multiple centers that the transplantation of systemic sclerosis patients with pulmonary arterial hypertension is feasible, viable, and a very reasonable option when compared to outcomes of other more accepted lung transplant indications such as idiopathic pulmonary arterial hypertension and pulmonary fibrosis. Thank you.